And tonight, a troubling COVID-19 trend right here in Shelby County.
Yet recent health data shows that young people under the age of 35, they represent the highest number of COVID-19 cases in our community.
Honestly, it's one of those things where it's like, we don't think it affects us, so we don't care.
That appears to be the attitude, not just here, but nationally as well. Fox 13's Kirsten Garris is live in Shelby County tonight. Kirsten, doctors say more young people are ending up now in the hospital with this virus too. And I want to hear this story, but I've got a question for you when it's done.
Yeah, Merle, and the people ending up in the hospital, doctors say they're in that 20 to 29 age range, and they say less people are wearing their mask in public.
It's going to happen either way, probably, because no one else is carrying.
18-year-old Kenneth Green says that's the general feeling among his friends about COVID-19.
Because at first I was carrying, but I see no one else's. It's like, I'm still going to get sick even if I try to care, it seems. So it's like, what's the point at this point?
Shelby County Health Department data shows people 25 to 34 represent more than 20% of active COVID-19 cases, followed by those who are 35 to 44. Dr. John McCullers from the UT Health Science Center says there's another worrisome trend, an uptick in young people ending up in the hospital with COVID-19. And even if they survive, McCullers says the impacts of the virus can last a lifetime.
We do see what we call morbidity. That means you may have long-term lung damage from having the COVID that doesn't go away. And, if you're 20-something years old, that's a long life to live with lung damage and with restrictions on your ability to breathe.
Do you feel like enough young people are taking this virus seriously?
It's a 50-50. It's definitely 50-50.
Some teenagers say they know the virus is real, but it's hard to know how serious it can be.
I wouldn't say that it's not possible for me to get it because, obviously it is. It's a real thing. But I've heard people that get it, and I hear people that get it that are younger that, they're, after fine afterwards they're fine. So it's like, it's hard to tell, how dangerous it all really is,
And Dr. McCullers says everyone needs to be safe and remember that social distancing. And of course, if you are going out and about, just remember to throw on that face covering or mask. He also says Gen Z needs to step up. These are the folks who are ending up in the hospital. So he believes Gen Z needs to take some more responsibility and encourage their own friends to take these precautions and take them seriously. Merle, Greg, back to you.
Okay, so here's my question. So Gen Z, that's, I looked it up, between 5 and 25 years old currently. So we get it. They don't see any way around it, so we might as well get it. So I'm going out on a limb, those are your peers. You're in that age group. What is the language that we're missing? What can we say, if anything, that will get them to be a little more serious about it?
We actually talked with Dr. McCullers about that, and he says, his generation and even people like me, we know Facebook, we know Twitter, but you have to reach people where they are now, and that's the TikTok, that's the Instagram. So he says really it is on Gen Z to send that message to other Gen Zers. He says, when they see Dr. McCullers, then when they see him, he's like, I'm an older guy, but if they see this message about wearing a mask, practicing social distancing, coming from their friends, then he says it might stick a little bit more because it's coming from a friend versus an official of some kind. So we'll see what happens, but it is very much tell a friend to tell a friend, wear a mask and be safe.
Right. Thank you very much. Great story. Thank you, Kirsten.